This is an ultrasound study of a 35 years old female presenting with the history of pain in the rectum during defecation and otherwise as well. Now, in view is this is the urinary bladder, anterior myometrium, posterior myometrium, and the cervix. This is the endometrial canal, fluid field. Tarikh kado aayi si tonu? Measures approximately 7.4 into 3.3 centimeters. So the uterus is normal in length and in width, and what we see is that it is being elevated by collection that is seen extending from posterior segment, lower posterior segment of the uterus, elevates it, and then it is traced up to the lower abdominal, up to the lower abdominal quadrant, and where it is bounded by a membrane. Now this is the urinary bladder. This is the urinary bladder. This is the wall of this cystic area with the multiple internal echogenic particles as well as echogenic material within it, and it measures approximately in this scanning plan 8.7 by 4.9 centimeters, and this is in fact a loculated cystic pocket with debris and multiple tiny internal echogenic particles within it. These are all echogenic particles giving no shadow at all. And this is a cyst with a cystic area with the calcifications, internal calcifications. Here you can see some shadow, and now this cystic area with internal tiny calcifications, marginal mostly, as well as debris within, seen extending from posterior of the lower, this is the posterior myometrium. It's elevating it, uterus, it elevates the posterior segment of the uterus, and we see fluid in the non-dilated endometrial canal. The echogenicity of the myometrium is absolutely normal, and longitudinal section that we are seeing, and this cystic area or a collection in the pelvic cavity, and then extending into the right lower abdominal quadrant, right iliac fossa, is consistent with the cause of her pain in the rectal region. Now, what can be the cause of this collection, I may not be able to frankly tell you, but this in fact is not a classic picture of a bleed. However, any manipulation cannot be ruled out without, and that because as usual I say that I am not provided with any clinical history, I am not provided with any lab profile, and neither do I have any other imaging modality facility. Or however, pregnancy test is negative that I performed in my lab, and you see this is the fluid component. This is the fluid component within this collection bounded by a thin membrane, and then measures, if I take both of these together, this one and this one, this pocket and this pocket, pelvic pocket and the one extending into the right iliac fossa, and is measured approximately 18 into 6 centimeters. So this is a complicated collection. Now in transfer section, see it. This is the transfer section. You can see the, now here you see this is the uterus in transfer section, this is the endometrial canal, and this is the collection. This is the fluid, and this is the urinary bladder. Okay. Now going upwards. Is there any other finding relating to this? If I cannot reach by transabdominal approach the vagina clearly because of the pressure from this collection on the uterus. This is the one. एक मिनट सबर थोड़ा जा बेटा बस हो गया ऐसे करना पड़ेगा पुत्र इतनी देर बिठाया तो मैं बस it's however not easy to rule out any possibility of manipulation. However, the posterior wall of the uterus should be concentrated upon. Can I get it? So posterior uterine wall is in fact, I am not getting the posterior uterine wall intact, rather from here onwards the posterior uterine wall is, well, there is, okay, it's okay. Okay, now from any other angle, let's see transfer section. Again, there is impression of some breach over there, and so that I will figure out that there is some history. There is something fishy that she is. Patient is not revealing and appears to be manipulation as a cause of collection in the pelvic cavity that is extending up to the right lower abdominal quadrant. Beta bas ruk do. Now 2 minutes sirf. This is all collection. तो होनी है इस तरह बेटा इसी तरह ही होनी है ना की करा मैं collection. This is the fluid filled non-dilated endometrial canal. निशाफ तेज आएगा तो फिर नहीं तेज बिल्कुल ही कौन जी गलत होना सी endometrial canal. Now this is the collection, this area. And you see the posterior wall of the, it's very difficult to get the posterior wall. I will recommend MRI or some other imaging modality for addition with this ultrasound of mine. Maybe TVS can be more helpful. here what I want to see is the ovary, the left ovary. Yeah, this is the left ovary. This is the left ovary, and follicular activity is seen in this ovary. This is the ovary, left, and the right ovary is not seen. This is the urinary bladder. This is the uterus transverse section, this area, and this is a collection. However, you can see that there are some septas also seen within it. These tiny linear structures are septas. So another typical case by transabdominal approach. Once again, a short review. No adjacent adenopathy was seen during my initial scan in this patient while she was having inadequately filled urinary bladder. So this is our case of the day. Thank you very much. Well, now this is a scan without after micturition or empty urinary bladder. I asked her to micturate. Now the urinary bladder is empty, and now she is revealing to me that she had 2 months amenorrhea, was pregnant, and went to a local LHV who inserted something into the uterus. So now when we get this history, your life becomes so easy that this is in fact all this is the retained products of conception, though we do see that the pregnancy test is negative, and so patient was concealing. Ultimately I got her to speak out the truth, and now she is revealing that she did visit a lady doctor because she was having a 2 months amenorrhea and suspicion of pregnancy. She inserted some, she does not know what, and then she started having pain in her rectum during defecation and post defecation. You see that now this is the cause of all this collection, which is in fact due to manipulation, and the collection extends from the posterior wall of the uterus, and that was the reason why I was stressing upon that I don't know, but it's very difficult to get the posterior wall of the uterus intact. It's not possible to get the posterior wall. Posterior wall is definitely damaged, ruptured, or whatever, and that is because of all this issue ultimately being resolved thanks to the patient coming up with the truth ultimately and giving us the proper diagnosis to make. So now, keeping this thing in view, see, this is all collection, and with dense coarse ecogenic material without shadowing, and we saw that they were numerous in amount, countless, with echoes. These are all echoes in this collection. And there is fluid seen in the pelvic cavity as well. Small amount of fluid is seen in the pelvic cavity. This is the uterus, the fundus of the uterus that you are seeing, anterior wall and the posterior wall. Now the in longitudinal section, this is the longitudinal section. Now post maturation, it's not unusual to see the uterus in this shape. Note that the fundus is intact, the anterior myometrium is intact, the outer surface is intact, that of the fundus of the anterior wall. Okay, now so far as the posterior myometrium is concerned and the outer surface of the posterior myometrium is concerned, what we see is that up to this upper half we can see it intact, but then and in the lower half we see a breach, and this breach that we see measures approximately, I say, 14.7 mm, and this area, thick echogenic band of area, is in fact the mesentery, thick mesentery. Now this mesentery is bony. This mesentery is so far confining the collection up to the pelvic cavity and the right adnexa, and then up to the right iliac fossa. So this is our case of the day, that is collection in the pelvic cavity extending into the right adnexa and then into the up to the region of the right iliac fossa because of intervention, intrauterine intervention to induce abortion. Thank you very much.